I just wanted to jump in here and share a story about something that really needed to change in my way of thinking in order for me to really understand chronic pain and to really start helping people with chronic pain. So if you're suffering with chronic pain and you're looking to learn a way to get in control of your pain naturally, that's backed by science, that's not super woo-woo, and without all that fluff and the gimmicks, then you're in the right place. Because I'm going to show you exactly how you can get your life back, get your identity back, feel less anxious and less overwhelmed and frustrated and sick and tired, so you can actually get control of your life rather than the pain controlling you. Now, I know that you've probably already tried it all, right? Like you've done the physical therapy, you've tried acupuncture, massage, injections, medication, supplements, all of that. Because all you want to do is to be able to not wake up every day not knowing what the pain has in store for you today, right? Like knowing if today you're gonna have to pay for what you did yesterday, if today you're gonna have to cancel yet another event and miss out on more important memories with your kids or with your family or your work. You want to wake up in the morning and feel confident in how your day is gonna go and head into it fearlessly. But there's something you need to think about. What if instead of just addressing the structural and mechanical faults like you have in the past, what if instead of treating the symptoms of pain, the symptoms of fatigue, the symptoms of brain fog, what if addressing the hidden changes in your nervous system worked instead? Then you'd be able to get out of bed in the morning, do the things that give your life meaning and purpose without the fear of pain just hijacking your day or your week. So a little bit about me. I'm Alyssa Wolf, and I am a chronic pain specialist, and I work with people with chronic pain to empower them to treat chronic pain naturally using neuroscience. Now, as a doctor of physical therapy, I found it personally very frustrating how healthcare providers seem to just pass patients around in the system, treating people with chronic pain like garbage and not listening to them, making assumptions about them, and not offering any real solutions. I found all of that totally infuriating. And as an Enneagram 1/3, as an achiever and a perfectionist, I wasn't okay with being just another provider like that. I wasn't okay with just telling my physical therapy patients either one of two things. Number one, you're not getting better because you're not trying hard enough. Or two, we've done all we can do and there's nothing else we can do for you. I wasn't okay with not having an answer and not being able to help them. I wasn't okay with those explanations that the doctors had, like, oh, it's just anxiety, or oh, it's just your weight. I knew that there was something else going on that everyone was seemingly missing. And as someone who personally really values science and evidence-based care, I thought it was really a cop-out for the doctors to pull the "it's just anxiety" card. To me, that wasn't making any sense. So early on in my career, I had heard about this new strategy that was showing lots of promise in the research, and I started teaching my patients these concepts that were a little bit outside the box. And to my surprise, as I stepped more and more out of my own traditional physical therapist-minded comfort zone, my patients with chronic pain started getting better. It was like something would click in their minds as they gained insight and understanding of what was really going on in their body, as they gained this real, tangible, scientific explanation for why they hurt and why the physical therapy and other treatments that they had tried didn't work in the past. Something had clicked that allowed them to heal, which then opened up this opportunity for me to share with them many other drills and strategies that they could use to address the root cause of their pain. So here's what you need to know to start gaining control over your pain, like many of the clients that I've helped over the years. What you need to know to be able to wake up confidently in the morning, knowing how your day is going to go, feeling energized and alive and confident about doing the things that you love, right? Like going to work, keeping a clean and tidy home, playing with your kids, going to social outings, spending time outdoors, traveling, and having sex with your spouse, like able to do these day-to-day things without the fear that the pain will flare up and derail you, sideline you, and wreck your day and your week, causing you to feel that guilt and that loneliness. To be able to wake up without that paralyzing fear that prevents you from doing the things that you love, that's what we want. You see, early on in my career as a physical therapist, I eventually realized something very vital. So think about this. As a physical therapist, I was expected to provide physical treatment, right? Either manual therapy or stretches and exercises. And what people really needed, people who are suffering with chronic pain, what they needed was something different than what they've done hundreds of times in the past with no result. They needed something that wasn't physical, because the problem they had wasn't physical, structural, or mechanical. If the strengthening of the joints and the muscles and correcting the alignment and all of that stuff wasn't working, then the problem wasn't the joints, muscles, or the alignment, or the inflammation. And you know what? I'll say this, it wasn't emotional or psychological either. Like so many of the doctors will say, like, it's all in your head. The problem lies in the activity of the nervous system, and the problem requires real neuroscience-based solutions, real ways to address the changes in the nervous system, to retrain and rewire those well-practiced, strong pain pathways in the nervous system. And that's what I've started showing and teaching my clients. And it shouldn't surprise me, but it does. It surprises me to hear the stories of client after client tell me that even within just a few sessions, a few of the first lessons, they've already seen improvements in their pain from these big pain flares, this constant pain, physically and mentally limiting pain, that even just by understanding their nervous system was causing their pain, was able to help them reduce their pain levels to like a 1 to 2 level. Like, could you imagine that? Like, could you imagine what it would be like to have days with a 1 to 2 pain? Could you imagine what it would be like to have days with 0 out of 10 pain? I mean, it sounds crazy, but it is possible. Okay, so I hope this makes sense to you, that the problem is not physical, structural, or mechanical. It lies deeper than that. It lies hidden in the activity of the nervous system. We can't see it, we can't test for it, but you've tried all that other stuff and you've had this pain for months, years, right? Like we're talking 10, 15, 20 plus years. Then the science would say that you have some nervous system changes causing all of this dysfunction. So I hope this information was helpful to you. If this was something you would like more information about and would like to talk more about this idea and ways that I could possibly help you, if you'd like to see if you're potentially a good fit to work with me, I've opened up some spots on my calendar this week to take calls. So I will leave a link below, and all you need to do is schedule yourself in, and we'll have just a quick chat. I'll assess to see if you're a good fit, and if not, I'll still be able to provide you with either a referral or some other recommendations, so you'll be able to get the relief and the answers that you deserve. Cool? Okay, amazing. Thank you so much for watching, and we'll talk soon.